Morning, everyone. Dr. Eric, the fitness physician, where I talk about hormone optimization, hormonal fitness, muscle medicine, health and body, performance optimization, and so much more. So, I've been doing a little mini series on myth busting and talking about some new things and changes, especially in regards to hormones and testosterone, things that I still hear and see online and from people talking. It's just kind of interesting. So, anyway, I thought everybody would like this. So, just some more data backed, science backed studies. Again, testosterone and blood, cardiovascular disease. We've been talking about how safe it is and actually improves cardiovascular outcomes. It will not cause heart attacks, thick blood, blood clots, all these kinds of things. That's the bottom line. Another journal, Therapeutic Advances in Drug Safety. There's an erythrocytosis and no adverse effects. Again, this is a whole other topic, but I hear this all the time. It's testosterone causes polycythemia, it causes thick blood. I talked about this in my other videos, and this is not the case. Polycythemia is different from erythrocytosis. You get a bump in your red blood cells. The red blood cells are what carry the oxygen throughout your body. Totally safe, no problems, never had an issue. Does not cause thickening blood. Yes, if you're taking grams of testosterone, and could it cause some thick blood? Maybe, but it's never been documented. That being said, obviously, if you're doing it safely, again, no adverse effects. And again, even in multiple journal studies, no adverse effects of this erythrocytosis. Again, just like there's people living at altitude, there's Sherpas in Nepal, there's people living in Denver, there's smokers, all these people have elevation of their blood counts. They're not dropping dead of blood clots and quote unquote thick blood. It just doesn't happen. So polycythemia is a completely different animal. It's basically similar to an autoimmune condition. It's a genetic disorder, and that causes other issues, mostly with platelets, which is what causes the clotting issues, not the red blood cells. Another study in the androgens, again, increase in hematocrit, those red blood cells, and actually had a reduction in mortality. Not an increase, but a reduction. And a lot of people had an increase in their hematocrit, their red blood cells, by 5% or more, and usually happens in the first 2 years or so, and it can be up as high as 52%. Oh my God, people are freaking, right? Because as soon as they get in the upper fours, they start thinking, oh my God, I gotta go give blood, donate blood all this time. No, it can be up to 52% or sometimes more, and they had a reduction in mortality. They did not have to donate blood every 3 months. They weren't dropping dead from thick blood. It just doesn't happen. They had a reduction in mortality, right? Again, across the board, reduction in mortality, no adverse effects. Study after study shows this, and I've seen this myself and my patients, all my colleagues, between all of us in my mastermind groups and societies I belong to, thousands and thousands of patients. So again, it's the difference between a baseline and a therapeutic trial. Same with estrogen. So if you get someone like, they take someone at baseline, measure their testosterone, estrogen, whatever, and they have an outcome, or they have a lab study, that's a baseline. There's other issues going on like visceral fat, inflammation, other adverse health markers. But a therapeutic trial is when you take someone and you give them estradiol, give them testosterone, thyroid, whatever that may be, and then you follow the outcome. And when you give it therapeutically, again, reduction in mortality, no adverse events. This is very different. So I'll get into this more in future studies, but again, more myth busting, more talking about the safety of testosterone in the blood and the cardiovascular system. So please like and share this post. And if you're interested in working with me one-on-one, check me out on seeing patients across the country in telemedicine, drericprimex.com and primexweightloss.com. Also, too, post holidays. Look, if you're looking to get in shape and lose weight, find out. DM me, type guide below, and I'll send you my free lose the gut cheat sheet. So just DM guide below, and I'll send it to you. Everyone have a rockin' good new year, and we'll talk to you soon.